Hi guys, good afternoon everyone. My name is Dr. Jennifer Okoye and I am a recent medical graduate from Abuja State University, and today I'm going to be sharing with you guys my AYHS 2025 experience. AYHS stands for African Youth Health Summit 2025, and I've gotten a lot of questions about what this event was all about, and I wanted to make a video just so I can briefly share what the event was all about, and also through some insights too that was also shared, and important information too that I think that you guys should also be aware of and should also have. So African Youth Health Summit is a program that was organized by Federation of African Medical Student Association, and it was a 4-day summit. So it started on 11th September and ended on the 14th September. It was hosted in Abuja, and we had a lot of partners. So African Center for Disease Control and Prevention was a partner. The World Health Organization was also a partner. We all have partners from African Medical Center of Excellence. We have partners from United Nations too, was also very kind to let us hold our events in their space, which was one of the highlights of the event. So it was very beautiful. International Federation of Medical Students, Federal Ministry of Youth Development were also partners. So like I said, we had a lot of partners, and Blue Cloud X was also a partner. So just you feel free to just check out all these organizations that I've just mentioned, and follow them, check what they're into, and just feel free to go online and just check out these organizations that I have just mentioned. So back to the event now. So like I said, it was a 4-day event, right? And the first day was arrival and the last day was departure. So basically we just had 2 days summit. So the summit was held in United Nations House, Abuja, and it was packed with a lot of activity. The first day, or the main day, we had keynote addresses from all our invited dignitaries. So we had the Minister of Youth and Development speak to us. We also had representatives from United Nations, representatives from WHO come talk to us, and also some of our partners to African CDC, Dr. Chris Kaniki also came and also shared some beautiful presentations with us. So like I said, it was packed with a lot of dignitaries that shared a lot of wisdom and beautiful presentations. Then moving up to the afternoon events, so we also had workshops which we had to select. So we had different workshops. We had workshops on international patient assessments and clinical skills. We had workshops on breast cancer awareness. We also had workshops on sexual and reproductive health rights. We had workshops on health equity. We had workshops on youth leadership. I'm going to just be sharing on the workshop that I attended. And the workshop I attended was the International Patient Assessment Instruments, Standards and Skills workshop. So that was the one I attended, and it was organized by Blue Cloud X. So this is where I'm going to be focusing on now, because I think this was the highlight of the summit for me. So Blue Cloud X is an organization that deals with clinical researches and ensuring that healthcare professionals are trained and certified on clinical skills. So this is their card. So this is actually their card. I hope it's visible. Yeah. So this is their card. So if you want to view their website, you can, scan their QRX code, just to know more about what they're about. So, but back to the workshop. So the workshop was organized by Mr. Al Pacino, and he was a very brilliant facilitator. And he introduced us to the different clinical skills that we needed to know as healthcare professionals, especially if you want to get a job abroad, if you want to, increase your chances of being employed abroad. So you need to be trained and certified on these clinical skills, right? Because as doctors, as health professionals, we always need to be up to date, especially with clinical tools that can help make our work easier. So Blue Cloud X has provided a platform where you can get access to these clinical skills, and you keep training yourself and you get certified on any training that you undergo. So for you to gain access to this, you need to first be registered under the Federation of African Medical Students. So that is where FAMSA comes. So you need to be registered. You need to be a registered member of FAMSA for you to gain access to their platform and their training and their certificates. So that is for the clinical skills, right? So another beautiful thing that Mr. Al Pacino also shared with us during this workshop was he also introduced us to clinical research. So if you're interested in clinical research, or if you want to know more about clinical research, check out his profile to know more about the clinical research, and also check out Blue Cloud X to more about clinical research. So that is in a nutshell what that workshop was about. We ended the day by visiting the African Medical Center of Excellence, which was also another beautiful highlight of my day. So I don't know how many of us know about this, but I'm going to be honest in this video. There was a lot of firsts for me in this summit. There was a lot of firsts. So this was my first time hearing of African Medical Center of Excellence, number one. And it was also my first time visiting it. And I'm very glad that I did. So if you've not heard about them, go online, browse them up. AMCE, that's the initials, African Medical Center Excellence, right? So browse them out and check them out, because they're doing really amazing work also in that organization. So it is a very beautiful hospital, very big hospital that has all the latest equipment that you can think of. All those things that we see in our textbooks or seems very out of reach, it is here in Nigeria, and it is there in the hospital. So I think the vision behind it was to bridge the gap between medical tourism. We invested a lot, and they've brought those equipment down to Nigeria. So it's not just for Nigeria, it's for Africa, the whole Africa. So instead of you leaving Africa to go and access, you can come within, your neighboring countries and just get access to this equipment if you need them, right? So I wish I had videos, but I think once the whole video of the whole African Medical Center tour is ready, I would also upload the link so that you guys too can also see what we saw. So but in the meantime, you can just check them up online and just look through their websites and see these things for yourself, and also educate yourself that something like this does exist here in Africa. So that was also very beautiful. So now for the next day was mostly discussions, panel discussions. So we had a lot of panelists. We had panelists from African CDC. Let me see, I think we have some of their pictures here. I don't know whether you can see their pictures. But these were just some of our panelists for the second day. I hope this is in the middle. I don't know. So this was some of our panelists. Miss Hawa Suleiman, that was the founder for an app called Talk to August. It is an app that helps answer female reproductive questions, especially in rural areas where this conversations are not being talked about enough. So women can just go on there and, gain insights, gain knowledge, gain experience without having to feel ashamed, about talking about these things. So that was also another very beautiful takeaway I got from this event. Miss Hawa Suleiman. Then this is Miss Roots. It's MedBrain. So you could also check it out. MedBrain is also another beautiful app that is really coming up. And this is the African CDC Senior Technical Officer for Strategic Program. This is Dr. Kaniki. Yes, that was also present. Then this is Dr. Joy, very passionate, very interesting. She's a technical officer for newborn and adolescent health and primary health care. So she works in WHO. So she also shared lots of beautiful, So also a representative from Nigerian Health Watch, Ibukun Oguntola. So this is him, Mr. Ibukun Oguntola. So he's the programs and advocacy manager at Nigerian Health Watch. He's the programs and advocacy manager at Nigerian Health Watch. So Nigerian Health Watch is an organization that helps to, they help to interpret and break down health, spread awareness, advocacy through storytelling, through the media, through any means possible that would make it understandable to the community, to the public, right? So that is, in a summary, what HealthWatch does. So we also had the CMD, not NMA chairman too. He was also a panelist too, Mr. Professor Mahmoud Raji. Danduba was the former 44th NIMSA president, but now he's currently the NMA chairman, Young Doctors Forum. This is Dr. Dambuba. It was also really nice meeting him. He is a very passionate and exemplary leader and a visionary. Then, of course, this is the president of Federation of African Medical Students Association. This is Muhammad Issa Jafar, our president. We call him Mr. President. Yeah. So guys, like I said, there are a lot of capacities in our panelists. So feel free to check them up, check out what they're about. And just before I conclude this video, because I feel like it has gotten a little lengthy, I just want to end by saying that even if you might not have been opportune to come for this event, I just want to drop a little word of advice that was given to me. So I'm also going to be sharing it with you guys. So the first one is start making change from your community, right? I know everybody wants to make change at the top. While we forget that before you get to the top, you need to start from where you are. So start from those little outreaches, start from your MSAs, your associations, start from your class, right? Start from your class, start from your hospitals, right? So the summary of everything we were told in this summit was just be the change you want to see. Guys, be the change you want to see. We can't keep crying about change and you don't even want to lift your finger and do something. What differentiates a leader from a follower is innovation. You need to start thinking like a leader. You need to start thinking like someone that has something to contribute. It's okay to be a listener. It's okay to hear other people speak. But sometimes when you're inside a room, lend your voice. Lend your voice. Don't think that you don't have anything to contribute. Don't think that your ideas are too small. Don't think that, guy, see, you only have one life. And if you don't give it your shot, if you don't shoot your shot, it's not cho. If you don't show workings, actions, the world will leave you behind. The world will literally leave you behind. The world, because the world it keeps running. The world will leave you behind. So start acting. Start acting. Guys, start acting. So this advice is also for me. So let me not be like I'm just dishing it out for it's also for me. I'm also speaking to myself also. We need to start acting, we need to start making a change. We need to start being consistent. We need to start being accountable. We need to start being inclusive, game changers. We need to be diverse, right? And another beautiful thing that they also shared with us was that document your progress, because how you started yesterday is not going to be how your tomorrow will be. So document your progress. Make use of your social media platforms for positive impacts, for positive changes, right? So make use of your YouTube, your LinkedIn, your Twitter, your Instagram. If you're still using Facebook, make use of your Facebook. Document your progress, because people need to see walk-ins, right? In order for people to believe in your vision, in order for people to believe in what you're doing, in order for people to see what you're doing, you need a platform where you can show them. So make use of your social media platform. When you do something good, document it so that you too will also be encouraged that, okay, I did this, right? I did this and it was successful. So why can't I do times 2, right? So guys, that's just one of the things I wanted to end with. And then finally, guys, we need to start reading. Yes, you need to start reading. Be up to date with policies, right? Start reading beyond, above and beyond. Be up to date with WHO works. Be up to date with African CDC work. Be up to date about initiative. That's why most of us didn't even know about this event, because the truth and the sad truth is that we didn't search for it, and it was out there, and there's many more out there that is passing us by that we're still not aware of. So guys, let's start searching for these opportunities. Let's start reading. Be bold. Leave your comfort zone. I think in a nutshell, this is Africa for Africa by Africa. So yeah, that we want to allow the young people to have a voice, and you don't even know what you want to talk about without your voice. So let us equip ourselves. Build yourself, guys. Build yourself. It's not just by crying that you want to be in the room where you can make a change. Do you have the knowledge to make that change? So engage with initiatives like this. Engage with your peers that are making changes. Attend summits, attend events, read up policies, youth policies, and know the policies that were even drafted up for you. Know what these policies are talking about. So just go online now and browse youth health policies, and you'll see all of them. So familiarize yourself with these policies so that when people are talking, you know what they're talking about, right? When try and familiarize yourself with these things, so we now know, okay, what we want to change. We don't like this, we like this, we don't want this to keep happening, right? We know how we want to modify it. So that's one of the things I also wanted to also let us know. And then finally, we need to also get involved with youth initiatives. So you need to be involved with youth initiatives. So go online. African CDC has wonderful youth initiatives that sometimes honestly it brings opportunities, especially if you're into research, you're into public health advocacy. Start researching. Use your phone wisely. Start using your LinkedIn wisely. Follow all these important. There's the Bingwa initiative. There's the YPC initiative. There's the Y8C4H initiative. There's the YPP initiative. There's the Bingwa Plus initiative. So many initiatives are out there and are open to you and I to take advantage of it. But the thing is, lack of information. So now that I have, in a way, tried to bring this to your awareness, I really hope we can build on this little that I have given us, and we will start using our social media better, use it to document and use it to follow up on all these important organizations, know what they're about, know what is trending, especially in the health sector, know about your health sector. if you want to be a youth leader, you need to know about what is going on in your health sector. So I really hope that this video was not too okay, no, it was definitely lengthy, but I really hope it was worth it, and that you guys were able to see what was shared with us at the summit. And hopefully when there is a African Youth Health Summit 2.0 edition, we'll come better equipped, because we had done our assignments and we had, read up more, and we are now more aware. So thank you guys for watching. It was really nice doing this video, and I really hope it helps somebody out there. If you think there's somebody that needs to watch this video, someone that's in the healthcare professional that has been looking to get into, that has been looking to be involved with, youth leadership, policy making, and all, just share with them. Medical students, 100 level, 200 level, 300 level, 400 level, 500 level final year, nursing professionals, any healthcare professional, as long as you're below the age of 35, you are a youth. And we all need to come together to change Africa, for Africa, by Africa. Nobody's going to come into your house and make it better. Only we can do that for ourselves. So please let us share this video and let us work together. Let us hold our hands together as we try to make Africa and shape it into the Africa that we have always envisioned, because the future is now. We're no longer the leaders of tomorrow. Tomorrow is now. So we are the leaders of now. So thank you so much, guys. And hopefully, if you have any more questions, just ask me in the comment section. If the presentations are made available, I would also let you guys know, and I would also try to share it. But also reach out to all those people in your MSs too that also attended this summit. Maybe they could also break it down better than I already have. This is just my only way of contributing. Bye guys. See ya.